Heart disease, cancer, COVID-19. The three leading causes of death for men according to the CDC. It's Men's Health Week, so how do we help our men get their health back on track? The Morning Medical Update starts now. Good morning. It's Monday, June 13. I'm Jill Chadwick in for Jessica Lovell. Thank you for joining us on Facebook, YouTube, and Twitter. Coming up, a big weekend at the K as the Royals teamed up with the health system to raise awareness of prostate cancer. We'll check in with Dr. Dana Hawkinson virtually with the latest COVID-19 numbers. You get to guess where he is today. But first, more than 50% of men have high blood pressure or take medication for high blood pressure, and that's just one of many medical issues men face. Get your questions to us on YouTube, Facebook, Twitter, and the Medical News Network. You can find the links right here on your screen. Men in America have some work to do. The numbers say it best. More than 60% of adult American men are overweight or obese, according to the National Institutes of Health. And according to the CDC, each year 350,000 men die from heart disease, and more than 700,000 will be diagnosed with cancer. Tack that on to the fact that only 3 out of 5 men get annual physicals. It's not a healthy outlook. Joining us now to talk about Men's Health Week is one of my favorite personal doctors, urologist Dr. A.J. Nangia. Researchers at the Cleveland Clinic say more than half of the men that they talked with said they don't want to talk about their health. That's concerning. Do you hear that?
All the time. And I think we have to just remember what the culture between men and women or boys and girls really is. If you think about it, we go for wellness checks as children because of our guardians, our parents, because we have to. Getting into school, getting into sports, it's all a requirement. And then eventually you turn 18 and you're an adult, and no one can take you to the doctor after that. And it's particularly bad in the male population, because then we just bury our heads, and until it's broken, we don't go to basically be seen unless some partner, spouse, or somebody kind of drags you in. And I personally didn't even go to the doctors after I was 18 till I was 40, so I'm no different than anybody. But I think what's interesting there is why. It's largely to do with the fact that women's health has been promoted so much better, and their general health with cervical cancer screening and breast cancer screening, and a lot of the social media and TV, Pink on TV is much more prominent, and women are just generally much more proactive about their health, including contraception, as we know. And so I think what has to change is the culture that men just bury their heads in the sand. And I think it's really funny that men are more likely to take care of their car than they are of themselves.
That would be my husband.
That would be about right. That would be about
me
too, actually.
Yeah. You know, they said that in that same study that 40% of men only go to the doctor when they think they have a serious medical condition. What would be serious?
Well, I think that's exactly the point, right? They bury their heads in the sand until they can't walk, they can't breathe, they get chest pain, or they get terrible headaches, or something drastic enough that they can't go fishing, hunting, go to work, you know, do all of the caveman kind of, I call it the caveman, I'm sorry, basically the hunter-gatherer kind of mentality of the traditional, you know, male role, but that's not always the case per se, of course. And I just think that we are just built differently, and I don't know what that is. It's genetic or nurture. I don't know which one it is.
And I also think, too, I know that growing up, that when some of the guys would be playing sports, if they felt like they had an injury, it was rub some dirt on it. Come on, get up.
Oh, yeah. I
go.
mean, there's a lot of this stoic behavior. Just get up, you know, and get on with it with your fractured femur, you know, and that just doesn't work. But, you know, there is a lot of this machismo and bravado that, you know, just work through it. Plus, as you said, risky behavior tends to be much more male-related, even though that's not true much anymore. But truly, historically, men were doing risky behavior, sports, aggressive sports. You don't see female football players as much as you do, you know, male, of course. So that's a classic description.
So remind us the important screenings for men.
So that's a really good question. Actually, I was fortunate enough to chair a panel, and it's called the Men's Health Checklist from the American Urological Association. And in that, we talk about not just urological screening, but obviously general screening. And I'm probably not the best person to ask about the general screening, but I can tell you things like colon cancer, HPV prevention, which is the virus that causes cervical cancer, to prostate cancer, obviously, to be screened from the age of 55 or 40 if you have a family history. So there are some very well-studied, very good data and robust science to say that this should be done. Colon cancer being one of the highest ones on that, thyroid maybe another one. But there is a list that most internists and or primary care physicians are well aware of to ask in their wellness clinic checklist.
On a similar note, you've got something to show us. You're very, very proud of the work that you have done. And
I am. I mean, I've been here for 16 years, but I've been doing this for over 30. And in Kansas, back in 2010, under Brownback, Governor Brownback, we managed to get a proclamation by the state of Kansas on Men's Health Week in the state of Kansas. And in this very, very short description is really much everything that, Jill, you're asking me about, all of the reasons for preventative care. And we did update this. Sorry, I didn't get it framed because it's only a year old and I haven't really changed it over. But Governor Kelly made it a month, actually. So that was last year, but these proclamations are only short-lived and have to be updated periodically with help from alliances like the Men's Health Network and many other advocacy groups, the Urology Care Foundation. So there are people promoting this and the states are recognizing it.
And why were you so personally passionate about this?
I think, first of all, I'm male. That might help a little. The second part of that is to do with what I do. And it's actually looking after young men in their reproductive years and then onwards. I'm a urologist, and traditionally we always think of urology being a male-dominated specialty. And really, of course, we look after females too. But historically, that's what we were known for. But in that light, I think that we have missed the opportunity over at least the last 50 to 60 years to promote better men's health. And that's just, I guess that's why I'm a doctor.
Yeah, that's a good answer. That is a good answer. Well, how else are men at risk when it comes to their health? Any top thing before we move on to
I think you hit it very well. Heart disease, prostate cancer is the second highest cancer amongst men, and lung cancer is the highest. Testicular cancer is the highest cancer of young men specifically, but it's not very high incidence of that, but that's why it doesn't get talked about a lot. But again, I have a son, and I've looked after many men who just avoid these topics that are very sensitive, and I think that it's imperative that we, as even any doctor, make sure we touch upon things that we don't even specialize in, like blood pressure, as you said, or go get a diet and exercise sorted out, but they have to listen.
And I'm wondering if some of these, like the high blood pressure, the extra weight, are they compounding?
They are compounding. At the end of the day, I say to every man is, what are you living for? If you're in this denial stage of your life, what are you living for? Don't you want to see your family grow? Don't you want to do some things personally? Well, if you keep doing this, you're going to limit your life expectancy. And I don't know how to get to guys being a guy other than being blatantly drastic.
Yeah. Okay, still to come is we're going to talk about one of the most stigmatized, sorry you guys, it's a Monday, most stigmatized issues affecting men. So don't go anywhere, but let's go and hear from some of our viewers. Alexis Del Cid is live in Studio B this morning. Good morning, Alexis.
Good morning, Jill. I have a question from Ron. It's a good question. He would like to know if having more sex can help reduce prostate cancer.
No, not specifically.
Is there any benefit to it?
Mental health, being happy.
Those are two good benefits.
Yeah.
But it won't help reduce your prostate cancer.
No.
That's our question from Ron. I have another question from Isaac. Isaac would like to know, and we know you're not a dermatologist, however, you've talked a lot about the disparity between men seeking doctors and women taking care of themselves. Isaac would like to know if you have any insight into why it seems to be that men are a lot worse at applying sunscreen than women. He says he was at Worlds of Fun and he saw several men who were badly burned, but the women were fine.
Right. Because men are indestructible, don't you know?
Right.
Because they don't get skin cancer, and
Right.
they don't stand in the sun and burn. They're all supermen.
Do they have regret?
Yeah, they always have regret. That's a very good question, actually. You know, regret is too late. When you
Right.
get diagnosed with cancer, what do you say? I wish I'd put sunscreen on. I don't know what else to say. I mean, I'm flabbergasted by my own maleness. You know, but you know, my wife is the one who insists. She drives me bonkers. She
Right.
makes me put sunscreen on. I'm bald. That's an inevitable risk
So-
of skin cancer.
Those badly
Because
burned
of-
men clearly didn't have women around them to keep telling them to
Either
put the
that, or
sunscreen
you
on.
know, I don't want to be, you know, gender centric, but anybody, just anyone who advocates for them,
Right.
because like I said, they'll put oil in their car, but they won't put sunscreen on.
Man,
This is true. Do you have any
Speaking to
other
the
questions
choir.
right now?
not right now. I had Isaac and Ron. I'll let you guys know when I get more.
All right. In the meantime, let's go to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us from somewhere pretty amazing with the COVID count.
Yeah.
Where are you? And I hope you have your sunscreen on.
Yeah, absolutely. There will be a lot of sunscreen and bug spray today out in Southwest Utah. Just going to be enjoying some national parks and enjoying nature. So we will be doing that. There will be a lot of sunscreen.
That's good. Good to hear. And I know you don't like those ticks and bugs, so I'm not worried about you. Tell us about the COVID count, though. How are we doing? How did we do over the weekend?
COVID count is still staying steady under 10 active infections. So we have 8 active infections, 1 in the ICU, none on the ventilator, 7 in that recovery period. And again, we are going to see fluctuations, I think, in our national data about 7-day rolling average of cases and hospitalizations. But right now, it continues to be much lower than it was in the winter with that Delta and Omicron surge. So I think overall, we're still looking pretty good. We just need to continue to promote prevention as well with vaccination and just testing early.
Over the weekend, I heard a little news about the White House ending the COVID-19 test requirement for international air travelers. How's that going to impact those numbers, do you think?
I don't think it'll impact that too much. I think that is a very important step that was made. I think that was an antiquated practice that was still ongoing. You know, Dr. Nanji and I both had colleagues who traveled to Europe recently. One of them got stuck back because their child tested positive, and they couldn't come back into the United States despite everybody being fully vaccinated. So I think it's a very important step forward, and I would certainly promote that.
San Juan, Miami, and Honolulu are now COVID hotspots. The New York Times reports all averaging at least 85 new cases a day per 100,000 residents, with test positivity rates about 20%. What do you make of all that?
You know, I think we're going to continue to see this just as we have recently or in the past during the pandemic. We are going to see communities that have higher rates and fluctuate. I think that can be expected. I'm not sure that is really making people not travel. I think, again, if you are at higher risk, it's an important fact to understand. But also when you're doing those things, continues to be important to wear masks in those areas where you are around a lot of people, such as airplane terminals and the plane itself, buses, anytime you're going to be around people. I'm not sure necessarily the American public is taking note of it and has too many other things to say about that. Otherwise, I'm not sure it's really delaying anybody's trips.
All right. The Children's National Hospital in D.C. is studying long-term COVID in children. How important is that? Is there a lot of long-term COVID in children?
Yeah, absolutely. I think that is one very important thing, not only for adults, but for children. You know, we know that children, they had said, in general, they don't have the preponderance of hospitalization and death, but we know that they can still be affected. They can still get acutely ill and feel bad. We know that they can go to the hospital, most importantly, we know and understand they can develop long COVID. So we know that with adults, it is going to be a horrible issue for hospital capacity and those individual adults' quality of life moving forward, just like heart disease and cancer. We know that children can get long COVID as well, and it's going to be important to figure out those mechanisms and the way to treat that to get those children's quality of life better and back to what it was before they had COVID.
All right. So do you have a big day planned today?
Yeah, lots of hikes, so it'll be good.
Can you stick with us for just a little while longer in case someone has a question? All right.
Absolutely.
We appreciate you taking us with you on your vacation. Now we're going to expect movies, you know, home movies, pictures, the whole 9 yards. Okay. All right, thank you. Back with us is urologist Dr. A.J. Nangia. We're kicking off Men's Health Week, and here are 3 more big headlines making news. The American Psychological Association reports that 31% of men have suffered from depression in their lifetime. So my question to you, does that come up in your clinic? And when it does, how does it manifest?
Very much so. I think we just have to now recognize, as we are, how much mental health that we've been avoiding to talk about. It happens in every clinic, and mine is no exception. You know, sexual health, reproductive health can be very depressing. It can be as bad as cancer for some in their young age group, and later on sexual health can as well. But that aside, people want to just talk, and they'll just tell you about their problems, even though they're not there for that reason. And I think we as providers have to recognize that. It's not shocking to me. I think it's going to be more than 30%. That's 30% of men that have admitted to it.
I gotcha. Yeah. Does it impact their ability to comply with your instructions?
It can. I mean, you'll be surprised on how many men are on antidepressants, anti-anxiety medicines. I look after the vets, and that's like almost ubiquitously. They all have been on some form of psychiatric medication. I shouldn't generalize, but you know what I'm saying.
Right.
And I think that that's very important to realize that it's so unrecognized and such a driver of everything else. Getting up in the morning, to getting, you know, brushing your teeth, to taking care of yourself. Because if you don't care about yourself, you won't want to do those either.
All right. And let's talk about male contraceptive, the gel. There is talk of a pill. Tell us about all the buzz.
So, as full disclosure, I'm involved in a National Institute of Health study that is looking at a gel that has testosterone and progesterone in it. And it's ongoing right now. In fact, I was in Paris recently at a meeting on this topic, and ironically, I got COVID. So Hawkeye's comments about being abroad are kind of really kind of sensitive right now, and I had to have a test, of course, to come back. But needless to say, up till now, there have been 2 forms of contraception for men: vasectomy and a condom. All right, and vasectomy is very effective, and it has a less than about 0.5 to 0.1% risk of failure, whereas a condom has up to 15% risk of failure. And here we are nearly at 60 years where the birth control bit has been around for women, and now we're still trying to develop a method for men, again, about trust and compliance. Mm-hmm. And at the moment, it's been very effective. Daily use of a gel has led to shutdown of sperm production, which then is reversible, and that's being shown in the study. And there are other drugs in the pipeline, both hormonal and non-hormonal, some of which are being developed right here at the University of Kansas Medical Center and in this hospital, which we're involved in some clinical trials.
I could imagine that with daily use requirement, there would be a trust issue.
Huge, and actually we studied that here just in the Kansas City area about 15 years ago when I first got here, and that was my very first question. And it turns out the more stable a relationship you're in, again, the more committed you are to preventing a pregnancy. And I think it's still important that men want to have control over their own reproductive health and not necessarily rely on the female partner who may not be a steady partner, maybe early on in their reproductive journey, if you know what I mean.
Yeah. All right. So another headline, as we talk about the importance of screening and prevention, you were involved with the HPV vaccine development back in 1986. Why is this vaccine so important, and especially for men?
Well, this is near and dear to my heart because of that research. And so, long story short, but my mum got diagnosed with endometrial cancer, not related, at the age of 40. And cervical cancer is a second, type of female cancer that's very prominent. And HPV, which is human papillomavirus, is a very big reason for the development of cervical cancer in men. Genital warts are what develop in men. They can get some cancers also if it's left too long. But in that over 20-year journey from bench to bedside, they call it, I'm so proud that there's a vaccine that got developed against that virus that is reducing very, very, very significantly the risk of genital warts, but more importantly, cervical cancer. And that in of itself is amazing. And my children have been vaccinated.
What
all
is the
four of them.
age for the vaccine now?
So if I remember correctly, you have to be a teenager and before you start sexual activity, and then you get your second shot later on in that time frame. But then you can get vaccinated as high as I think 45 now. I think the CDC has increased the limit. Dana may have a better memory of that, but nevertheless, it's both male and female, and that's very important.
Dr. Hawkeye, do you have a different recollection of the vaccine and when you should get it?
For HPV?
HPV.
Yeah, absolutely. This is an extremely important vaccine. I think both boys and girls now are able to get it at age 9. There might be a little bit nuance there, but I believe at age 9, both boys and girls can get it. It's extremely important to get. I think Kansas is one of the lower states as far as vaccinating their young children against HPV. I know my children were able to get it as soon as they turned that age. So very important. Would certainly promote anybody, parents, loved ones discussing if they know young children to get them vaccinated against that as well.
Yeah. Can you hear the nature sounds behind him?
I can.
I know. Isn't that lovely?
We need to talk to the virtual background people and add sound in the background of chirping birds.
Yeah, that is so nice. All right, let's find out if there are any reporters on the line today and if they have any questions. All right, let's go to some of our questions from our viewers. Alexis Del Cid is live in Studio B this morning for us. Good morning again, Alexa.
Good morning. I have a handful of questions, and for both of our doctors who are on today. The first one is about vaccines. Melissa would like to know the stats that are coming out about under 5 vaccines show that 80% for Pfizer, 37 to 50% for Moderna. Is that comparable, though, since Pfizer began testing before Omicron? And would it make a difference for symptomatic disease in which vaccine the parent chooses? Dr. Hawkinson?
Yeah, good.
Yeah, I think that's a very insightful question. I don't know that the vaccine data does include Omicron. I'd have to look back, but I know that the data was collected before the brunt of Omicron hit. And I think what we are seeing now, and I don't know that it has been made public about the full data set for both Moderna and Pfizer, but I think what they have promoted is, for the most part, against infection. Again, we know early on the vaccines for adults had excellent activity against infection, but really that is not the goal of the vaccines. The goal of the vaccines is to continue to reduce the chance of those people, whether adults or children, going to the hospital and having severe disease. And we also know there is a minor effect in preventing long COVID as well. So I think that is going to be the more important data to identify when those data sets are made possible.
But
overall, I think, I was just going to say, overall, the vaccine continues and will continue to be safe and efficacious. So will be a good thing for sure.
Dr. Nangia, Saul would like to know if there's any such thing as a temporary vasectomy. We know they can be reversed, but is there anything akin to a temporary vasectomy?
So they've had a lot of, maybe at least 4 or 5 versions of plugs that you have to stick into the tube, and then they claimed that they could be removed. I say that claimed because none of the studies lasted long enough. And actually, it's knowing that the anatomy of that vas deferens, the tube itself, you touch that and it scars. So then putting a plug and taking it out, I have a healthy degree of skepticism. Let's just say 3 or 4 of them have fallen by the wayside during development. There is a new one out that's being developed that is a gel that kind of stops the sperm, and then it can be, and then it dissolves and has to be redone in 6 months or later. But they're just starting their first human trials right now. I think the concept is an easy one, almost like a faucet on-off, right? But truthfully, I think the anatomy of the tube itself and how sensitive it is to scarring might be a problem unless something, great and wonderful develops in the next few years.
Tony has an interesting question, and maybe you can help him navigate this, doctor. He says I don't always feel my doctor takes me seriously when I address my doctor. How could I address this with my doctor?
That's a really, really good question. The doctor-patient relationship is ultimately all about trust and confidence and listening. And, sometimes it's okay to ask the elephant in the room question is, hey, doc, I feel like you're not talking to me, you're talking at me. Can we kind of re-establish, a ground, where we can be, communicating better? Or patients go elsewhere. Naturally, they will find a doctor, hopefully, many times through word of mouth, that is that doctor, right? And that's a very good question. I think it's our job as doctors to listen.
I know that Dr. Hawkinson, occasionally we've heard you say it's time to get a new doc. I think that's your phrase sometimes.
Yeah, absolutely. I think that that advice about listening, as a physician or a care provider, it's extremely important to listen to that patient, listen to what is being said, but also try to infer and pick up on maybe things that aren't necessarily being said and read between the lines as well. But I think listening is important in your daily life and being present in that situation, in that interaction with that other person, whether it is professional, a doctor-patient relationship, or your other interpersonal relationships throughout the day as well.
Yeah, I do think it's important, though, to remember something very important. And I don't mean to patronize like parenting, but sometimes tough love, people, is not received well, right? We're not there to be their friend. We're there to look after them and also be compassionate or empathetic. And I think it's important to realize that, we're not just here to be customer service and please them. We are there to tell them some things that are tough truths, sometimes about general health. Get seen, right? So that can lead to a conflict, not conflict, but a difference of opinion, if you will.
All right, Alexis?
Lavanya has a question. She would like to know, and this is something that Dr. Hawkinson and Dr. Nangia, I think you could both help us weigh in on, how she can help her spouse be more self-aware of his health, rather than, I'm assuming she means, make him go to the doctor, or go to the doctor with him. What are some things that we can say to our partners?
So let me answer that. This is very near and dear to my heart. All right, very near and dear to my heart. Right? What is it that what makes men tick? Their responsibilities, their sense of well-being, in the sense of they look good, or not look good. What is it, right? And I usually start with, what do you care about? What do you want to live for? Do you want to live for your wife, partner, children, mother, father, anything? Remember, we're going to Father's Day soon, so this is a very important topic, right? And when it's like the Rocky moment, when Rocky put up a picture of Mr. T or Drago on his mirror, and that was his aim in life, was to beat them. I think men need to have a goal. I don't mean to make this gender, centric, but being a man, this is how I think. So if you give them a reason to live that's more than themselves, they might actually do it. I won't lie. I took care of my health to look after my children and my wife. Was it for me? I guess so. It seemed very secondary to me personally. But the truth of it is, if you give a man and get really into their core, then often they might listen, like stopping to smoke. How much is it costing? All right? How much are you not putting towards your family? How much are you not spending on going fishing? Right? That kind of stuff. You just got to get to the core. I don't know about Dana, if he feels differently.
Dr. Hawkinson?
No, nothing to add. I'm not sure about the advice. I think it's just continuing to sit down and and have those conversations with your partner. You know, certainly I see that much more in the hospital with the men looking to their wives when I'm asking them about their health history and what they're doing. They really just seem to defer to their wives a lot. So I think it is multifactorial, and it's continuing to sit down and try and have those conversations to take a hold of that health care, whether it's preventive or treatment.
More viewer question, and this is one that I think a lot of us are wondering about because we see it so much on social media and the ads online about low T. So can Dr. Nangia talk about low testosterone and what men should look out for?
That's a tricky question because it's actually a long answer. But bottom line is normal change over the years. I call it menopause, right? Like menopause. We don't have a specific time when, you know, hormones stop. They just decline over age. Middle age spread is the old way of calling it. 3% per year after the age of 40 is a decline in testosterone. Now, you don't need to be treated for age-related decrease in testosterone. The marketing of this, which I'm ashamed to say, has had a big role in over-emphasizing a number, some symptoms. And we have to remember something very important during Men's Health Week and really every day of the year. All right, people talk about low T, and I talk about weight, diet, exercise, sleep. Guess what? All three of those or four of those things lead to low T. Low T is not like the only thing in life that causes libido loss or energy loss or cognitive, meaning thinking, foggy. I mean, talk about how much we're on our phone, how much bandwidth we have, how much sleep we don't get. Let's come back to some basics during Men's Health Month and Week and century and millennia, right? I think we've got to come back to some fundamentals. Diet, exercise, sleep. How about that? I didn't do anything for that. I didn't go to medical school for those three, right? But I will tell you that that's become a huge problem, is that hormone replacement or lack of has become this thing that has become, pardon my way of saying it, but sexy, right? It's the way we fix all of the things. It's like losing weight without diet and exercise. Just take this pill. It doesn't work like that. Nor does replacement magically fix everything. And I think that's the bottom line to that question.
All right. Alexis, do you have any more?
One more question. This is a COVID question. Ashley would like to know if there's any plan that in the future we might start treating COVID like we do now with the flu or other viruses, i.e. no longer recommending isolation, quarantining, and masking. I think she's just wondering, is it ever going to be a thing that we just collectively decide we're going to live with without masking or quarantining?
Yeah. That's a really good question. I think it's really hard to look into the future. Obviously, we know that we have made steps to reducing things like isolation days. I think moving forward, that certainly is reasonable. What is the time frame? I don't know that we know that. We know it's still continuing to cause really devastating disease, especially for those at high risk. And by that, I mean your risk of death is certainly much higher than it is with influenza. But now we do have better treatments for it. We know we have vaccines. We know other vaccines are going to be coming out. It may be a step in the future. I don't think we're there yet. You know, if you remember, one of the common cough and cold coronaviruses of the four that we know about probably jumped species from an animal to humans, 500 to 1,000 years ago. What was it like at that point as far as the overall disease it would cause humans, because we had really never seen that virus before? How will our individual bodies or our collective human immune systems now react and be able to handle the virus overall, really trying to prevent that morbidity, that severe illness, and of course that mortality, the death. But I think those things will happen. I don't know what that time frame would be, though.
Very good.
Right, that's great. Mm-hmm. I think I'm the kind of person now that I'm wearing the mask all the time because I don't want anybody's cold. I don't want their flu. I don't want the COVID for sure. So I think being able to have that as an option is really nice in this day and age. All right.
Absolutely.
So let's wrap up the very first of Men's Health Week with final thoughts. If you had one final thought, Dr. Nangia, what would it be?
Ooh, okay. I have thought about this during the time I've been talking. Please take care of yourself. It's up to you. It's not up to anybody else. Let's go into Father's Day every day, and every year let it be Christmas. Every day be Christmas. And take care of yourself and for your loved ones. That's my message for coming up to Father's Day.
All right. And Dr. Hawkinson? Happy
Yeah,
Father's
I
Day
think
to
it's
both of you, by the way.
Thank you.
Thank you. Yeah, I think it's an easy one-word final comments, and it's prevention. You know, we at the health system really do appreciate and are privileged to be able to treat people that come to our health system, our hospital. But our main goal is prevention, and we would rather and prefer that you get active prevention, whether it's your cancer screening or your vaccinations. Why? To keep you out of the hospital, to keep your quality of life good, to keep you having good times and being with your family and friends so that you don't have to be here. And we know that there are simple things you can do for prevention, vaccinations, screening, all of those things, talking with your medical providers, mostly to keep you well and keep you having a good quality of life.
All right. You have a good quality of life today as you go all over the Utah mountains, all right? All right.
Yeah,
Remember,
we will.
take a couple of pictures. We always like those.
And don't sprain your ankle.
No sprained ankles. All right. We'll talk with you on Wednesday. All right. Thank you to both doctors. Great content this morning. As we say goodbye this morning, the heat wasn't enough to stop thousands of men from around the metro from learning how to improve their health. Yesterday was Prostate Cancer Awareness Day at KAUFFMAN Stadium. Folks from the University of Kansas Cancer Center answered questions, and they let patients know about testing as well as treatment options. Dr. Terry Sue, Physician-in-Chief and VP of Clinical Services at the University of Kansas Cancer Center, says days like this are important because it gives doctors and prostate cancer survivors a chance to learn from each other.
Us doctors, we only know so much about what a patient goes through. And so our journey walking side by side with patients is so important in educating that next patient.
About 1 in 8 men will develop prostate cancer in their lifetime, according to the National Cancer Society. And when detected early, the survival rate is near 100%. Is that correct, Dr. Nangia?
Yep, if you catch it early.
Yep. Cancer Center handed out koozies and hand sanitizer along with information to anyone who wanted it. Thanks for being with us today. Don't forget you can catch our updates anytime by logging on to Facebook, YouTube, and Twitter. Join us tomorrow for a very special episode of Morning Medical Update, and we'll be back here live Wednesday at 8 a.m. See you then.
Healthcare is not equal for all. Twice as many Black men die of heart disease. Black women are more prone to late-stage aggressive cancers, while Black girls are often assessed differently when it comes to mental health. Dr. Steve Stites looks at these important health disparities on the next Open Mics.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.